So the omega-3 fatty acids that we get come from a super clean source that's sustainable, and we can trace it back to the boat. Like, I love that, and I love the fact that you can literally take one of these out of the bottle and pop it in your mouth, and it doesn't taste fishy. That's how clean it is. So you can go buy a big bottle of something from somewhere, right, which some people have done that. What if you're not finishing that bottle for 6 months? Last I checked, I don't want 6 months old sushi. Right? So I think it's critical that we make sure that what we're taking has a specific potency, and LifeVantage has solved that problem for us. All we have to do is take it. And in this, because omega plus, right, so the essential fatty acids that are the omega-3s, and the DHEA to EPA ratio is critical for brain and eye. People ask me about that, and so what we're doing is we're affecting those primary tissues, and that's why the ratio is the way it is. It's a very common question we'll get. The other thing is they'll talk about the dose.
Yeah.
They talk a lot about, is that dose high enough? What we're doing is, do you want to have a disease to take something?
No.
Right? Do you guys want to be sick?
No.
Okay, well, neither do I. So all the products are designed for what? For vitality, right? It's vitality. So, and just out of curiosity, how many of you have noticed massive changes in your own bodies with these products? Right, look around the room for just a second. All right, guys, those are people experiencing results with these products, not cure, prevent, or treat, but that's what they're noticing, because these products are different. The reason why there's over 800, healthcare providers in LifeVantage in the business is because the products are so solid, and because the science is so solid. And for me specifically, it was because of hands like that. It was somebody else's results that caught my attention, right? And so the products we have are second to none in response to that. So when you're looking at the omega-3 fatty acids, having them and coming in from a very clean source, that's been covered. And to have it with the vitamin D in place, and also the omega-7s, huge. Now the therapeutic dose is a little bit different. Like if somebody's got something going on and you're actually measuring the levels, Dr. Gordon and I were talking about this earlier today about, is there a time where you might increase the dose of the omega-3 fatty acids? And so I kind of want to have you hear what he told me on that.
Yeah, before we get into that, let me just tell you about the freshness of the fish oil. So, being in a cardiology world, I get to see the pharmaceutical fish oil reps come in too. Okay, so there are drug companies that make fish oil, which is the most expensive fish oil in the world. And one day, one of the reps came in with one of them, and I said, "Have you ever cut one of these open?" He said, "No, I haven't. Let's do it." So we cut it open, and it smelled like rotten fish. Okay, this was a pharmaceutical grade fish oil. And so after lunch, when I went back downstairs, my nurse, when I walked past her desk, she kind of went, "Have you been cleaning fish?" I mean, you don't want to be putting stuff like that in your body. So if pharmaceutical companies have fish oil that's not fresh, you know that there's other bad fish oil out there. Ours is the freshest, as Dr. Brimhall mentioned, that I've ever seen. So getting back to the dose, or tasted, yes. Yes. Have any of you bitten into one of them? Yeah. It doesn't taste bad, does it? No. Try that with other fish oils. You're like, ugh, it's horrible. With regard to dosing, as a cardiologist, obviously I'm interested in the cardiovascular protective effects because the heart is more important than the brain, I think. No, you may disagree. I don't know. We can have a debate about that.
I don't know, but there's no electricity to the heart. There's a problem.
True.
Okay, we'll talk later.
Anyway, so there's been a lot of controversy about the protective role of fish oil in cardiovascular disease. And if you read, the medical literature, you'll see one study where it helped, the other study that it didn't. But here's the problem. In those studies that didn't show a benefit, they just gave the patients a specific dose of a fish oil and said, "Here, take this." Okay, but if you look at the studies where they actually measured the fish oil levels in the people to find out, number one, if they were taking it, and number two, if they were getting adequate levels in their blood, the results were much different. They were all very positive. And so there's a test that you can have done. It's called an omega index, and it measures the percentage of omega-3 fatty acids in your red blood cell membranes. And you want it to be 8% or higher. And here's why. When you look at all of the studies with thousands of patients, in those patients that had an omega index of 8 or higher, they had an 80% reduction in cardiac event rates. Wow. 80%. Guys, that's better than any medication out there. So because of that, I want to have an omega index as high as I possibly can. My omega index is 10, and I take 10 to 12 of our omega plus per day.
And just from the standpoint of when you measure that, I've measured these for years, that omega index, and literally I think I can count on 2 hands after like probably 5 or 6 years of running this test, people that had a normal or optimal omega index, and every single one of them were taking high quality fish oils for longer than a year. So super critical that we have that in it. Just how beautiful all you have to do is like open the Vitality stack up and take it.
So you have a good point. It is a cumulative effect. You cannot expect that in 2 weeks. You pop a few pills and then you think in 2 weeks you're going to see a difference. It takes time for the body to build the reserve and have that in every cell so it can be detectable at that level over 8%. Dr. Gordon, did we talk about, when we talk about NRF2, about why physicians don't, I don't think we talk about that here. So we are talking about physicians, and a lot of physicians do not know about NRF2. I mean, I get this question all the time. My